Hi.
Hello.
Hello, just doing a sound check. This is Kathy Owens. Can you hear me?
Yeah, can hear you loud and clear.
Hello, everybody. I'm Don Jurovich. We'll get started here shortly as a few more folks join our meeting here. If you don't mind, for those that are attending this meeting, it would be nice if you could put in your name and your affiliation, if you could, in the chat box. Okay, it looks like we have had a few more people join us. For the new people, if you had not heard, we would appreciate if you could put your name and your affiliation in the chat box so we can get a little better understanding of who's participating in this Flipped Echo series. For those who are new to the concept of Flipped Echo, Echo is a basically a telementoring program that was developed, well, quite a few years ago, based upon the concept of all teach, all learn. And typically the presentation is a brief introduction to a topic, followed by a case report, followed by a discussion. So that's the ECHO format. What we're doing here is we have, we call it the flipped ECHO because the presentation was sent out as a video. And that video should have been reviewed if possible prior to this meeting. And then that allows us to move forward on the agenda to do the case report and then the discussion in a little bit more compact fashion. These meetings are scheduled in the formal part of the session for 30 minutes. And then we have another 30 minutes of optional time for people to carry on the discussion. So why don't we get started? This session is the fourth of four sessions that we've had on resiliency. We've entitled it Building Resilience in Maintaining Quality Care in Nursing Homes During COVID and Beyond. We're now in the next phase of the post-pandemic. So we're going to focus today on community resiliency. And the next slide, please. This session is brought to all of you through the Great Plains Mountain GWEP Consortium. For those who may not know what a GWEP is the Geriatric Workforce Enhancement Program. And this is a collaborative between the University of Wyoming, Utah, North Dakota, and Montana, each which have a so-called GWEP, or Geriatric Workforce Enhancement Program. This program is funded by HRSA, and as a disclosure, none of the opinions or educational materials are any part of HRSA. These are all through the universities. So the opportunities that we're presenting through this short series, for those who had participated last year, we had 12 of these. This year we had 4 with highly focused on resiliency. And so the format is that we've had these microburst videos. You can go back to these videos, or if you have not seen them, they're posted on the website for the Great Plains Mountain Consortium. And maybe in the chat here someplace we can put the link to those if you hadn't known about the access to those. We'd like you as ambassadors to share your experiences, particularly with frontline staff, the CNAs, nurses, housekeeping, all the staff, because basically a lot of these concepts are universal. We want resiliency amongst all workers, and to share these elements of and recommendations for resiliency should be understood by all members of the long-term care community, including residents and their family members, by the way. And then really the ultimate goal here is to generate some ideas for all of you in long-term care to create a PIP through the QAPI process. So we kind of think in terms of shovel-ready quality improvement. So we give some ideas, and then we give some coaching during these meetings. We can do this offline also, by the way, if you want some further advice on how to move forward on quality improvement, because not only do we have the universities involved in this in their geriatric programs, but we also have the quality improvement organizations as represented by each of the area states. Okay, next slide, please. So the agenda today is we're going to go briefly over the microburst video on community resiliency. We'll have a presentation for a case study and some discussion about that. And then we'll move into the QAPI project. And I hope my timer is keeping an eye on me, because I tend to be, I wrote some articles for some newspapers here in the area about age-friendly healthcare, and they said I was too wordy. I talked too much or wrote too much. They wanted 500-word articles and not 1,500. So anyways, I appreciate the timer here. Next slide, please. Okay, so do we want to launch the poll here? Rebecca, is that your, there you go. Thank you so much. First question is, I listened to the pre-recorded session on team resiliency. Just answer yes or no. The second one, the presentation was informative. And whether you agree or not agree. And there should be a third one, which was the content was relative to my life or work. So thank you for submitting those poll questions. So if you did have an opportunity to see the microburst or the short videos, there were two presentations. And the first one, overall, we're talking about community resiliency, and we're trying to hone in on the concept of a long-term care community, which again involves the workers, the residents, and the family members. And fundamentally, the long-term care community has had a lot of challenges and stresses over the last 2 to 3 years, in addition to the usual stressors that were posed by the pandemic. And so the whole question of resiliency is, how do you respond to those stressors and how do you recover and adapt to the disruptions? And so there's always that adage or the concept that challenges make you stronger. And so that's where we want to come out on this, is to identify how prepared we are. Are there set responses or anticipated responses? Try to create a sense of teamwork and social cohesiveness. We also want to look at the question of diversification of our resources, and also to have redundant systems in case one system fails us. So there was a presentation by Dan Buettner, who's the son of Dan Buettner Sr., and who founded the Blue Zone concept. And basically what the video talked about was a presentation on the Blue Zone mission, which is a longevity project. It helps people understand what the best habits are in our life to live a long, healthy life. And the blue zones are basically areas around the world where people live abnormally long. They live disproportionately long, up to 100 and even older years of age. And so they found that the common thread between all these blue zone areas is that people tend to move naturally. They have a lot of, they have a mobility plan, they get around. They have a sense of purpose. I always talk about that with my patients. I said, what do you do when you wake up in the morning? And if I get a blank stare, I know we've got some talking to do. The other part of downshifting, maybe that 6-ounce glass of red wine is the downshift, especially if it's in the social context. There's the 80% rule where you don't eat everything and on your plate, and that there's a plant slant, which is your food should be more plant oriented than meat oriented. So basically that's the blue zones, and we want to apply these concepts as best possible in our long-term care setting. And then finally, the flip video or the micro video showed or talked about the kindness campaign, and basically an appreciation and recognizing staff through various random acts of kindness. So we can have the next slide. Okay, so Natasha, are we going to play this video?
Yes, Jenny will be playing that.
Very good. So take it away.
We appreciate what you've done in your 22 plus years you've been here as a sort of and someone that cares about the residents. That's why we have Ron here as well. We're very grateful for you.
Well, thank you.
We know that you make a difference for our facility. You're making a difference for the residents that are living here as well. You are what Bighorn Rehabilitation and Care Center truly wants to exemplify. To make sure that our residents feel cared for. So I just want to say thank you. And so as the administrator of the building, I just truly want to express my gratitude to you and to what you've been doing.
Thank you for all you've done for me as far as making sure I get ready for school on Monday with my work goals and other stuff like that, especially when I don't have any family up here right now. You and Pete are my immediate family right now. And I appreciate it very much.
Well, I love you like one of my fourth boys.
Well, hello, everyone. This is Kathy Owens, and that was just a marvelous example of the kindness campaign and the joy that it brings to all involved. So thank you so much for sharing that. What we'd like to do now, as we've done in our prior echoes, is take the information that we've been learning and apply it to some potentially real scenarios. And we want to hear from each of you as we walk through these scenarios. So next slide, please. Today, we're going to visit Great Plains Vista Community. This home or community was established in 2013. They are able to serve up to 58 residents at a given time. 43 of these residents are long-term and 15 are short-term. They do have a really active resident and family council. That's a really good hint, I think, for everyone to have not just a resident council, but a family council as part of the culture in the community. They also have a very active spirit committee, or some people may call it a retention and recruitment committee, but it's a spirit committee for the care associates to build a culture, once again, that inspires longevity and longer commitment of time with the residents. Now, as the prompt for this series has been how to be resilient after the COVID pandemic, we thought it would be helpful just to look at what this particular community has experienced during the COVID pandemic. They actually had 3 COVID outbreaks, and similar to many communities across the nation, their first outbreak did occur before the vaccine was available. That was their largest outbreak, and it included 28 residents and 33 care associates were affected. Also, 3 of their long-term residents passed due to COVID. And we all know that seems very clinical, seeing that written out here. However, it usually represents some grieving that the residents and the care associates have usually experienced as a result of residents passing or even staff passing from COVID. They had a second and third outbreak. They were much smaller, attribute to the power of the vaccine and also to the power of good, learning more about infection control practices, and all of their affected residents and staff are recovered. So that gives you the scenario of the Great Plains Vista community. Next slide, please. So today, what we would like to discuss, and really want to hear from you, is the following question, your response to the following question. The resident council president is very concerned about the morale of the residents as well as of the care team members at Great Plains Vista. The council has been talking about this, and they've noted that there's been a significant change since COVID pandemic started. So the resident council president approaches the life engagement coordinator to discuss, and some folks, the title might be activities director, and in particular in this community, it's the life engagement coordinator. So the resident council president actually is reaching out to the coordinator to discuss. So now, after reviewing the microburst content and hopefully you've listened to the microburst, seeing an example of the kindness campaign, we'd love to hear from you what you think the next steps that the life engagement coordinator and the president of the resident council can take to address these concerns about morale. Once again, you may unmute to share your thoughts. We'd love to hear from you personally. You are also welcome to place comments in the chat box. So and Natasha reframes this in a wonderful way. How has the pandemic affected the morale in your community? How have you all addressed this, and what next steps could be taken? So what are your all's thoughts about what next steps? As your music, go ahead, Don.
Yeah, Don Jurevich here. I would just, as a jump start to the conversation, let everybody know that there was a very interesting article in the New York Times about healthcare workers. It was focused on physicians, but it applies to all healthcare workers, about what is being termed moral distress. So not necessarily morale, but it does relate to morale.
Mhm.
And the question is, what is getting at the center of this anxiety, and some of the things that we're being asked to do in terms of documentation, for example, is, how that takes more time than being with the resident or with your patient. And so a lot of providers are really getting distressed about that, and it's subtle, and it's not really very clear as to whether they're expressing themselves, and so that I would just refer that New York Times article on the moral distress of healthcare workers or of physicians, and it's a very interesting read. So we just open up with that comment.
Yes, thank you. That's an excellent comment, and it definitely is being seen across the country as well, across the world. The angst that has been spawned by the COVID pandemic and everything we've all had to endure. And in thinking about that, I also like to think about the great information that was shared in the microburst about the blue zones. And I was thinking about this question all week to determine how would I respond to it. And one of my thoughts is that I love that the resident council went to the life engagement coordinator. That particular role is sometimes an under-recognized role in our communities. It's an extremely powerful role and sets such a tone for culture. And it is also a way to, that particular person and department can imbue some of these principles of the Blue Zone. I was thinking about how, wouldn't it be fun to develop engagement calendar of activities that would follow those 4 big purposes of the Blue Zones, such as something to do. So working with the residents, knowing their prior interests and hobbies and occupations and what would be interesting to them, and how can you translate that into allowing them something to do. Say if they used to love gardening, having gardening classes. And so it gives that sense of purpose that Dr. Jurevich was just talking about, the importance of that sense of purpose. Also having something to look forward to. So creating activity calendars that really bring excitement and something to look forward to. Having someone to love. So creating an environment that fosters friendships among the residents and visitors, and it becomes this very fun, engaged community. But thinking about how do our planned activities actually foster these principles. and then giving someone the opportunity to give back. And that's something that I know residents have told me for years and years and years that they really miss, is the ability to care for others. They've been parents, they've been in occupations where they serve others, and they want that opportunity again. And trying to work those concepts into our routine day-to-day calendars, I think might be a helpful guide. Linda also adds, it's important to listen to each individual, engage them on a personal level to learn more about what is impacting them. Is it loneliness? Is it worrying about family? Is it feeling hopeless? And then making sure that the team is aware. I love that, Linda. I think that's really, really important. LaDonna Peters shares that we had a Mother's Day tea. Oh, I'm sorry, go ahead. Oh, sorry. We had a Mother's Day tea and a Father's Day pie social and invited families. That's always helpful, and it gives that connection that is so important and was so present in the Blue Zone examples. And then Crystal Morris has given you the link to the Kindness RX videos that you can actually use and share with your teams and be able to reproduce that. And you're right, Natasha, the staff may also have great ideas on how to improve morale. We keep acknowledging the importance of really having everyone involved in this process. And the direct caregivers usually have the best idea of what's working, what's not, and how to create solutions to challenges they may come upon. So those are
Kathy,
great ideas. Yes,
Kathy,
ma'am, go ahead.
This is Renee in Montana. And one of the things in the previous slide that it talked about, though, was that the resident council, I think, had identified and shared with the life engagement coach also that the morale of the care team members had waned. And so I do think, I'm sure this would happen automatically, like in morning meetings and that sort of stuff, but obviously for the life engagement coordinator to pass that on to the administrator to be able to take action and you know, figure out next steps there.
Absolutely, absolutely. Get leadership involved. Excellent point, Renee.
And I'd also point out the what I don't know if you want to call it the Debbie Downer, you know, but there are some people that you know, just carry a like Linus, you know, carry a cloud over their head, and sometimes identifying those folks and having a sit down to you know, figure out why they are, if they weren't that way before, but if they are accentuating a you know, a personality trait, that might be an opportunity to have them consider different approaches, you know, towards you know, exuding happiness and, you know, appreciation as opposed to complaining all the time. You know, it's funny, I get some very good feedback from my patients in my clinic. You know, so we always dread these so-called Press-Ganey reports because they always rate the doctors on a 0 to 5 scale. And, you know, every once in a while I get a 1 where the patient says, yeah, he tested my memory and I came in for my hip and I don't know why he's testing my memory. And they were just really upset with me. So I got a 1, which is not a good score. But somebody had pointed out that I was complaining about the computer, which, you know, if there's everything to complain about because the computer wouldn't start up and wouldn't do what you asked it to do. But you know what? Patients didn't want to hear that. So that was a good example where I thought I was sharing, you know, some empathy, sympathy, or whatever, sharing an experience, thinking that older adults may, you know, relate and say, oh yeah, those darn computers anyways. But actually, no, it wasn't centered on them. The focus was on the computer and not on the patient. And it was a message well received. And so ever since then, I've not been complaining about the computers. I just smashed them.
Thank you. Those are great examples. Thank you for sharing. Next slide, please. So we've been doing some sharing of examples, but we'd love to hear from you if you have any specific examples that you all have used to help promote community resilience. Feel free to share your thoughts or place comments in the chat box. I know we're getting a little short on time, so
down there, everybody's sleeping.
I think if everyone can make sure you're muted out. make sure that you've muted yourself out. Thank
I'll
you.
call Ron. Thank you.
Please make sure you mute out. Thank you. Potluck lunches, those are great examples. I think now what we'll do in the interest of time, we'll go on and transition to Adrian. And then we'll encourage everyone to stay on the line if possible, and we'll have more discussion on these topics in the next 30 minutes. Adrian.
Thank you, Kathy, and thank you, everyone. What a great presentation. Excellent case presentation, and love the ideas, especially the engagement calendar. That's when we've heard a little bit on different topics, and I just love that. So thank you, everyone, for your contributions. Today, quickly, we're just going to cover some quality improvement elements, as we always do in our sessions together. As we have shared, if anybody has any results or experiences from the kindness campaign or things that you've tried in your facility, please go ahead and share that in chat. We'd love to hear if you've been incorporating those random acts of kindness and how that's been going in your facility. So please go ahead and put that in chat as we go forward. Next slide, please. So as you heard on our microburst video, today we're focusing on community resiliency, which is the ability of the long-term care community to adapt, respond, and recover from various challenges encountered, and encompasses the collective capacity of individuals, organizations, and systems to effectively navigate and withstand adverse events. We've discussed a lot of fun and innovative ways to infuse resiliency in the work we do with our residents, staff, and community members. And it's important to note that these efforts are an excellent quality assurance and performance improvement opportunity, and our handy PDSA cycles are a great way to start the process. So putting our efforts in this format allows us to collect meaningful input, design work that impacts the right targets, and demonstrate meaningful changes. When looking at community resiliency, we understand that community presence or social cohesion is an important factor in organizational resiliency and resident quality of life. So if you were starting with that first step of the PDSA cycle, which is the planning step, you may consider, as we've already talked about just now, involving your staff in this conversation. They are a great wealth of knowledge in this area, and it also, as has been noted in the chat thus far in today's session, it's a nice way to help incorporate and boost morale by involving them in these conversations. So hypothetically, just join me on this and say that you do get your staff together and you start to collect some input, asking them what are the ways that we can connect with the community that will impact our residents and also improve morale within our teams and staff. Explore the information that you have on hand, and also remember to seek input from a variety of different teams and departments. Sometimes we tend to go to the same units or the same teams, and it's important that we're getting input from all of the different teams that we have in our buildings and facilities. Next slide, please. So once you have collected that input, it's time to get started. So you would gather the input, bring that to your leadership team and let them weigh in on priorities. And let's say that you determine that you're interested in implementing a volunteer.
Hey, Ron, this is LaDonna, getting back to you. Virgil's
LaDonna,
phone is plugged
you?
in and it is working. It has the dial tone, but Mr. Virgil is sleeping.
Please
she picked it up
mute.
and it has a dial tone.
Please.
I am unmuted. Okay.
Mm.
So let's. Sorry, I keep getting muted by the host, so I will try to keep going. So let's say that you've gathered that input and you've decided that a volunteer reading program would be a good opportunity. So perhaps you find a local organization that's willing to partner with you. I live in Utah. We have a lot of faith-based organizations that volunteer and do a lot of different service in our communities. So perhaps you partner with one of them. You work with your staff to identify 1 or 2 residents that you feel would be open and appreciative to the opportunity, and work with the staff in supporting those residents and participating in this program, starting small and going slowly from there. Next slide, please. So after time, you do see that that you are seeing some progress, that you're seeing some positive impacts. And so say you incorporate that to additional residents or really expand it to your entire unit. Just a couple notes here to be sure that you're tracking your results, and don't forget to share your successes with the rest of your team in your facility. I know that we are up to our time, so I will just quickly wrap that up as a nice idea to consider for your quality improvement efforts, and I will turn it back over to Dr. Juravich. Thank you.
Wonderful. Thank you, Adrian, for that. Adrian has the best color blue closets that I've ever seen. So I'm always trying to figure out what tone that is. So thank you for that. So we're going to go to the poll questions there. So if we can launch that. So the first questions I found to today's webinar is informative. And the second question is, I'll be able to use the information in the session for my work. So we appreciate you answering those questions. Really, the next steps are to, firstly, if you can take a picture of that or the QR code and to help us with what we call the post-series echo evaluation. It's actually flipped echo. And so there'll be some questions there that'll help guide us for future planning for these kinds of sessions. We really want to bring the universities and the quality improvement organizations together as a collaboration with the long-term care facilities to really keep a collaboration going and to identify best practices, keep the quality improvement moving, and really help using our content experts to help you get work done better. So better care typically for older adults, but for all ages, and also to improve the environment for staff, so that it's a job of joy and not a burden. So the next 30 minutes will be sort of an ad lib, open conversation. So for those that want to stick around, that's wonderful. If you've got, your class is dismissed, so you can move on if you wish. No worries there. In terms of adopting a resiliency intervention, what we'd like you to do is do a survey or do an evaluation. Either it could be through the advisory council, staff, visitors, or all three, and to identify what they're feeling, and to get some ideas as to what might help with the intervention. A lot of people put down, some ideas, about food offerings. Sometimes a facility will request a food truck to come by, and people get a ticket to get something from the food truck. Others have used potluck luncheons. Where I work in Fargo, you can always expect a Jell-O mold to show up at our potlucks. So I think it's a very 1960-ish kind of thing. So that's great to see the tradition is being maintained in our neighborhoods. But basically, we'd like you to set up your PIP, your project improvement plan, through the Plan, Do, Study, Act cycle. So you plan to do something, but you have to have measurements, right? And so if you're measuring, frustration, anxiety, whatever, there are tools out there. You can ask our quality improvement organizations for assessment tools. You can ask our university partners for assessment tools. You can make your own assessment tool. It could just be a general survey. And then you get that information, and then you apply your intervention. So if it's the potluck luncheons, you do that maybe once a month for 2 months, and then you go back and do the survey again and get the information and see if you've made a dent. And if you did, good, you keep moving on. If not, then you come up with some other ideas as to what might work. So that's the Plan, Do, Study, Act cycle. If you get a chance to go back and look at the blue zones, I know somebody was asking about what is the blue zones. The blue zones are historically areas around the world that were identified by a demographer, actually from Italy, who he went around to Italy, and he was finding these villages that had a lot of 100-year-olds. I mean, like a lot of 100-year-olds. And he was trying to figure out, like, why are these people all living to 100? And so they started to gather information about their life practices. And they found that, for instance, in Sardinia, that they drank wine that seemed to be a part of the relaxing effect. They walked a lot. They were mostly agricultural work, a lot of sheep herding. And so a lot of physical activity contributed to it. They ate very lightly. There was no high BMIs in this group. You don't see people who live to 100 typically that have high BMIs. So that was another observation. And so that was the idea, is that they tended to eat small plates. In Spain, they're called tapas. And for those who are interested, I actually was in Chicago. I went to a tapas restaurant. And if you slur the words a little bit, it kind of sounds like topless. And so we asked for directions to this place, and apparently the guy didn't hear tapa, he heard topless. And he said, "Oh, you're in the wrong neighborhood, son. You have to go someplace else for that." And so we eventually found the restaurant. But yeah, so small plates are called tapas. And so that's part of the intervention for the blue zones. And socialization is a big one. So if you take some of the ideas from the blue zones and apply them in the long-term care setting, I think you're going to find some good benefit. And so that's why we brought up the blue zones. That was one of our ideas, is to show how, the blue zones affects towns and villages. And so it's an engagement with the population to adopt Mediterranean diet. They have walks, they have community socialization activities. So it could be through the parks and districts. Obviously, in long-term care, it would be more through either the resident council or the administration or family members that start to organize and get together and put together events to socialize. And I recall one facility, for example, revealed that they were doing those remote control race car, remote control race car races. So that was their social event. You can see here the resources. So thebluezones.com. You can get more information for that. I put in the chat that the Blue Zones has an app for facilities or organizations to use for improving, or ideas for improving wellness. And then there's the reference to the kindness campaign. And then finally, we highly encourage you to access the quality improvement tools to continue with the QAPI. With that, I'm just going to look. Do we have any other questions from the chat there? Natasha, can you see anything? I know the Blue Zones question. I don't know if we have any other.
It looks like for comments, Crystal says, "Does anyone grow their own gardens that residents care for?" And Larissa mentioned too, she said, "Tapas are great food to be shared by the gathering group." So we have a lot of really great ideas on sharing. And I just encourage you all to continue to do that. And if you feel comfortable, come off of mute and share some things that have been successful with improving community resiliency, what things you focused on within your own organizations and communities.
Yeah, and interestingly, I don't know if I have this right, but the Asian Indian culture has thali, where there's small plates or small offerings that so you have little tastings of different curries or foods and vegetables. So that's another thing. One of the things that we were considering in our clinic was that we have people from all over the world. We have one of our nurses is from Portugal. There's a lot of Scandinavian backgrounds, and so we're asking folks to bring in a representative food from their culture, and that's part of the potluck. So everybody gets a tasting of whatever folks bring in. Any other thoughts? Any other comments that anybody else wants to make? Please unmute yourself.
Well, Dr. Jurevich, this is Kathy, and those are awesome, awesome insights that you provided. I have a different kind of question for the group. I'm particularly really curious how our attendees have embraced the PDSA cycles and the concepts that have been suggested over the last 4 months. with the idea that trying to keep it to a small project, hopefully easily implemented. And I'm just curious if anyone has any feedback on that process and if it worked for you or if you have recommendations on how to make that even better. Have you all had an opportunity to be able to use the PDSA and select one of these topics? Well, we may not have been able to get some of that into practice, but we would encourage hearing from you guys as you work through these and use this in your CWAPI process. We're always looking for ways to make CWAPI easier and more relevant, and be able to have a sort of a rapid way of getting some feedback from that process. That obviously some projects will take longer than others, but we're trying to make this as relevant and as efficient as possible. So any feedback you have on that would be awesome. Thank you.
Yeah, I appreciate that, Kathy. The CWAPI to me is like trying to be consistent with my weightlifting and resistance training. You know, it's on my mind, but you know, I only do it when I do it. You know, it's not consistent, and so I think that's part of the culture that needs to be developed. You know, these small changes in behavior towards, I don't know if you want to call it corporate culture, but you know, certainly in long-term care, that everybody thinks about quality improvement. And I think part of it, quite honestly, is setting aside time to do that. And in the absence of having devoted time to, whether it be 15 minutes, 30 minutes, let's take our pulse on CWAPI. Where are we at? What do we need to do? Have we been, you know, slacking off? Are we on pace? What do we need to do to get back on track if we've been off track? I mean, a lot of the quality improvement got derailed during the pandemic, and it was all focused on infection control, rightfully. And so a lot of the drift that we've had in, you know, what I call the moral distress has been because of, you know, the lack of the other quality considerations that we need. So yeah, I'm just reading Jackie's comment here. We have not just coming out of the post-COVID stuff. What the focus was for so long. Exactly, we really bring this to the front lines for QA. The managers have been so COVID tracked, just trying to come down from it. Yeah, perfect. Yeah, we're getting a little bit of a, you know, it's like drinking those cold drinks. You know, you see McDonald's now is advertising the brain freeze. You know, don't drink or drink too fast. You know, sip it because you're going to get a brain freeze. Yeah, that's basically what I see it as. Is, you know, we got COVID freeze, you know, from all that focus, and so it's hard, you know, and some people aren't prepared, you know, for the socialization. And I'll be totally honest with you. I for the first time since the pandemic, I've been taking my mask off going into department stores. You know, I was still wearing my mask, and I'm kind of thinking to myself, well, you know, at some point that's got to go. But it's taken me this long, you know, and obviously 99% of everybody else has been, you know, fine without the masks in department stores. But I'm still suffering from the anxiety from being in the clinic and diagnosing and, you know, signing off on 24 death certificates from COVID and, you know, a bunch of other things that still are lingering in my psyche. So I think just having that appreciation is, you know, is helpful. You can also ask people. You know, somebody had commented about the. Jackie also commented about she appreciated a job of joy and not one of burden. And so the question there is maybe just a simple survey is, are you enjoying your job? You know, I had a department chairman who would ask me, he says, do you like what you're doing? I said, yeah, but if it wasn't for such and such, you know, it would be great. Well, you know, you have to have a basic understanding or feeling, you know, as to whether the work is fulfilling and enjoyable. And if you identify people who can't answer that question, you know, my wife and I have a friend whose CNA at a area nursing home. And every time we ask her how things are going, she says, "Oh, it's great. And I did this and I did that." And, I mean, she's always expressing some of the positive things that contributions that she's made. And she's very proud of that. And I think that those are the kind of folks that we're looking for in healthcare in general. And so I think that's a good example. Anybody else have any comments about how to build resiliency at the workplace, other than food? Tomorrow, by the way, I'm bringing in bratwurst for 4th of July celebration for our clinic. So I'll probably get reprimanded by the clinic manager because they're going to be cooked in beer, but we'll see.
Mhm. Dr. Jervis, this is Kathy again. And one of the things that comes to mind is, I think I shared this once before, but is using the mission, the organization's mission to help drive engagement. And where I saw that work really well was a particular mission had 6 different components. And so the residents were asked to select a staff member that represented like teamwork, compassion, integrity. And it really was just amazing what that spawned. And it did drive the whole piece of engagement, and it energized around that the morale. I do personally think in our part of healthcare, the mission becomes even more important, and it needs to be sustainable, and it needs to sustain people's passion about the work they're doing, and ways to integrate that mission into what you do is I find to be really important. So,
Yeah, I agree with you. And
re-energize.
I like Jackie's comment. Now, so we have different nicknames for everybody. I call it Debbie Downer, and now we have Negative Nellies. So maybe we should take a survey of what you call those. I don't know. Another word is curmudgeons. Those sort of very perturbed, disturbed, or whatever. Folks. One of the other techniques administratively is to use the feed forward approach. So a lot of times we're reactionary. We see, oh, so and so is like, just, off all the time. They're always they're complainers. So the alternative would be rather than to give them that negative feedback, would be to give them feed forward ideas like, over the next week, what can you do to to uplift somebody's attitude or resident attitude? What thing will you do to contribute to a better or to their happiness? And so you give that feed forward. You ask them to do something in advance. It's time limited. We want you to do this within the week, and then let's talk about it. Jeff is talking about sharing examples of how your work directly affects the community. I think sometimes we get so busy, we miss the benefit that we are providing. Yeah, absolutely. In a cynical way, you could say that's marketing. In a very uncynical way, it's a way to represent our contributions. And I think I think that kindness video was a good example, of being spot on and representing all the positive things that we do. And folks just don't realize that. I mean, I think a lot of times people view long-term care just very negatively, because a lot of people say, don't send me there. I hear this all the time. And we try to promote it in a light of, that there is considerable positive opportunities there. And I often tell the story of one of my patients who wound up in a long-term care facility, and he came back later and said best thing that ever happened to him because he was party central. So we need to share those stories. So thanks, Jeff. Do you want to make any comments, Jeff, about your observations of what you've done with your program? I don't know if you're able to unmute yourself.
Hi. So our group is just a little bit unique in that I work with the Department of Public Safety in the state of Utah, and we do work with people who are older in our communities, and a lot of them are associated with driving. So a lot of times it's difficult because people come in and they're frustrated because we're talking about maybe they have a certain medical condition that might affect their ability to drive some more. And so it can be difficult for the people who are meeting with those individuals to say, hey, your medical condition affects your ability to be able to drive. We either need to work towards improving your medical condition or working with healthcare providers, or what we need to do is, see improvements in your medical conditions to be able to facilitate that. And so sometimes that's difficult for the staff to be able to tell them that, and also for the people who are receiving that information to hear that. So when we oftentimes meet with those individuals, we try to encourage them by saying, hey, you're not really losing all of your ability to be able to accomplish or do something. You have these other resources, you have family members. And also for the staff, we're trying to improve public safety. So it's really hard. And I have a background of working in the medical field for about 15 years. And I understand from the other side of a healthcare provider too, that sometimes when people are in nursing homes, they're very unhappy. The workers work really hard. And the people who are there sometimes aren't very happy. So having a positive attitude and reminding everybody what we're there for, and just trying to encourage everybody the best you can is so helpful.
Yeah, thanks for those comments. I mean, it's almost would be nice if we had a little pixie dust that we could sprinkle over the negative Nellies and so forth. But I think there are techniques to engage people that tend to be on the other end of the spectrum, and looking at the positive things of that. And there's always going to be a group that see the glass half empty, and that's just human nature. And so the question is that we don't dwell on the half empty glass, but rather that we find ways to through this feed forward mechanism to encourage people to achieve certain behavioral interventions that are measurable, right? Who did you make happy this week? How did you make the difference? What did you do to make them happy? So, very concrete, kinds of things. So one of the things that we're doing through our North Dakota program is to use storytelling. And so we've hooked up undergraduate students primarily with older adults in long-term care to tell their story, their life stories. And the students then create a book that they give back to the older adult. And it's so far, for the half dozen or so folks that we've worked with, it's reduced depression considerably. Actually, I was shocked to find out most of these people that responded had clinical depression that needed to be treated, and how it slipped the primary care, provider measurement, one can only, guess. But again, the storytelling is very, very, very important, and is very effective. So that's one measure, for improving resiliency. Okay. Does anybody else have a comment? I don't want to close shop, but if we are at the point where we have no further comments, anybody else would like to share their resiliency story?
Dr. Jarovich, this is Crystal from Mount Pacific, and I just wanted to alert the team that I did throw in the link that I referenced in my microburst, and it was a study done within the nursing home realm, and it talked about these bonuses and financial incentives. It wasn't worth it, and it's a really good read because it talks about what made them stay was the way they were treated. And so somebody had reached out to me via email to share that article, so I thought I would share it with everybody.
Wonderful, thank you. All righty. Well, I want to be mindful of people's time, and for those that hung in here, which was about a little over about 60% of our participants. We really appreciate you staying on and helping with the conversation. If you have any questions, or you can use the surveys to give us some feedback if you have some additional topics that you would like presented, or you can contact any of our GWEPs, Utah, Montana, Wyoming, or North Dakota. All you have to do is just type in Google and do GWEP, or Geriatric Workforce Enhancement Program, and it'll take you to our sites, and you can contact us. So thank you so much. Any closing comments, Natasha?
None for me. We should be good to go. Thanks, everybody.
Okay, thank you. Take care.
Thank you all.